Okay, so I'm doing task 5, which is setting up all the equipment and monitoring a patient under anesthesia. So we've already got our patient intubated and hooked up to the machine. So before we get everything hooked up, first thing I'm going to do is make sure that his heart rate's okay. And one sounds good, so we're going to go ahead and start setting everything up. So first thing we're going to do is the pulse ox. That goes on any mucous membrane, usually a pink spot. So we're going to do the tongue. You can do ears and toe pads as well. Turn that on. Okay, so that measures the concentration of hemoglobin in the blood. So it also just does his heart rate as well. So SpO2 is at 100 and 129, which is a good heart rate. And this is also our capnograph, so I'm going to hook this up. So this just hooks in between the tubes. So I'm going to get that hooked up. And our capnograph is going to measure the inspired and expired amount of CO2 that he's inhaling and exhaling. And this also does his respiratory rate. So every time it goes up is when he's exhaling. So we've got that hooked up. So next thing we're going to hook up is the EKG. So this is right on right. It just goes kind of close to the elbow, in between the body and the elbow. And then the red on the left hind, black on the left front. And we just put a little bit of alcohol to get those started. While we're doing that, we'll go ahead and hook up his blood pressure cuff. So this is going to go on the leg opposite of the catheter, and this is going to, of course, measure his blood pressure. Okay, so now our EKG is set up. And last but not least, we've got our esophageal stethoscope. So this just basically lets us hear clear heart sounds. So grab the lube. So we lube the end of it a little bit. So slide down easier. Just pull the tongue, and this is kind of just blindly fed in. We just want it to about the 5th rib. Okay, so now that we've got everything set up, we'll start doing our monitorings. So we monitor every 5 minutes. So basically we'll just go through on our anapsych chart, set his fluids up. This is a fresh needle. So his fluid rate is 150 mils per hour. So go ahead and put our blood pressure on auto and get that started. So our heart rate is at 127. And then we'll look at our SpO2, first at 100. And we'll go ahead and look at mucous membranes and get a temperature on them as well. So mucous membranes are a good way to look for tissue perfusion. So you want to force that to be less than 2 seconds and for him to be a nice pink. So he is nice and pink. We've got less than 2 seconds. And we'll get his temperature as well. And that is 99.3. And of course we've got him on an ISO level of 2, and we've got his oxygen set at 2.3, which is his correct rate. So let's see, so his blood pressure is kind of low, so we're going to want to, if we can, turn down the ISO at all and up this fluid some. And we'll check and see that. That's kind of, we have to watch a trend for that, and we'll make sure that that's coming back up for our next, once it reads again. So I'll go ahead and write down what that, the main one we're concerned about is the mean. We want that one to be up around 60, so his is 47, so it's a little low. Okay. And his CO2 is hanging at around 50, which is good. You want that in between 35 and 55. And then we'll just have to count our respirations. Okay, so that was force, that is 20 beats a minute. Okay, so that is all of our stuff for our first 5 minutes, so we'll record again in another 5 minutes. Okay, so it's been 5 minutes, so we're going to chart again. So heart rate is still at around 122. SpO2, we're at 100 still, so that's good. Our blood pressure, we've gotten it to go up. I've dropped him down to 1.5 on the ISO. And up his fluids to 210. So his mean arterial pressure is 68, which we wanted above 60, so that's perfect. So go ahead and try that. And then our capnograph for our CO2 is still around 50. And then we'll count our respirations. So that was 4, so that is 20. Which is the same as last time, which is perfect. We want the respirations around 8 to 20. Usually it'd be a little bit lower for a bigger dog, but that's still within limits. Heart rate's within normal limits. We want that around 60 to 150. And other things that we'll check for are we want to make sure that they're on a correct surgical plane of anesthesia. So you have to check reflexes, of course mucous membrane colors, all that kind of stuff. So some of the things that you can check for, one of the main things are eyes. So you can check for the palpebral reflex to see if they blink at all, which he has no blink. And then we also want to check for the positioning of his eyes. Once they start out there at central and then they rotate medioventrally, and then they come back up to central the deeper they go. So we want to make sure that they are. You want to make sure you watch them the whole time and they're not getting too deep. So his are central, so that's fine. He has no reflex. He's not, hyperventilating or anything like that if you can feel any pain. So he is good right now. So the only other thing we have to do is we want to make sure that we give him a breath every 5 minutes. We're going to get that up to between 15 to 20 centimeters of water every 5 minutes to create positive pressure ventilation. So our pop-off valve just has a button we can push, so we don't actually have to twist it. We'll just give him a good breath and let go. So the last thing we're going to do is, as she's finishing up, usually when they start suturing, we want to start decreasing the anesthesia some. So we're going to decrease the ISO down closer to 1, and we'll just slowly lower it so that we can leave them on oxygen for a little bit afterwards and they don't have as rough of a time recovering. Okay, so we're almost done with our procedure, so just going to go back over a couple of things. We wanted to make sure the whole time that his, from the EKG, the heart rate and rhythm, that he had a nice wave form, so he had a normal sinus arrhythmia. We just want to make sure that there are sinus rhythm. We want to make sure there's no arrhythmias or anything dangerous happening, so you do have to know the difference in all the waves. So his was normal. SpO2 stayed at 100 the whole time, which you wanted above 95%. That lets you know how well the tissues are perfusing the oxygen. Heart rate, of course, you want that between 80 and 150. His is a little high, especially since we just decreased his isosis right then in the procedure. So usually it would be a little bit lower for a bigger dog. I want to watch that to make sure that that they're not feeling any pain or anything during the procedure. The capnograph that measures the amount of inspired and expired CO2. You want that to stay between 35 and 55. His stayed around 50. That's just another thing that tells you about ventilation throughout the body. And then our blood pressure. Ideally, you want that mean arterial pressure around 60. His has been a little low the entire time. We've been lowering his ISO and increasing his fluids. So you just kind of have to work on that and watch the trend of that. So that is pretty much it. You want to make sure that the whole time that you're checking for watching, your eyes are the biggest thing. Machines, obviously help a lot. But you want to make sure that you can see your patient breathing, and you want to make sure that there's a heart rate, so checking pulses if you can. If you have the esophageal stethoscope, listening for the heartbeat. Checking mucous membrane color, that's a really good indicator of tissue perfusion. Making sure that there's enough, the blood is perfusing through the body as it should. And of course, the eye position, like I said, checking that palpebral leaflets to see if they're too light. And then checking the position of the eye, you want to make sure you watch to make sure it stays central. If it does rotate ventromedially, you want to make sure that it doesn't go back central because they're too deep. So you want to try to keep them on the lightest plane of anesthesia possible, but of course making sure they don't feel anything. So this is a pretty quick little procedure. We're almost done. So we try it every 5 minutes. So that's pretty much it. And so now that we're done with our procedure, we're going to go ahead and take all of our monitoring equipment off. So we'll unhook our EKG lead. Take off our blood pressure monitor. We can remove our esophageal stethoscope, so that has to be cleaned, and then we'll take off our CO2, and then the last thing will be our pulse ox, because that lets us know the heart rate. So now we can go ahead and move this patient. Okay, so I'm just going to go ahead and clean up everything after we did that surgery. We're going to clean off all of our leads and our blood pressure cuff and everything. So I'm just going to start with the leads from the EKG. So with these, we're just going to want to wipe these down with alcohol. You don't want to use any kind of disinfectant or cleaner or anything because that can be corrosive to the metal. So I'm just going to go through and wipe all of these off. Just clean down the leads too. Okay, so then I'll hang these up. And then same thing for, we're going to use a little bit of diluted Rocal as a disinfectant for the blood pressure cuff. This isn't something that's super sensitive because it's got a cloth coating on it. So you just want to kind of gently wipe it off. And then we can go ahead and unhook the cuff, hang our line back up, and then we just have a bag of all of our different size cuffs. So I'll go ahead and put that in there. Then our the lead on our SpO2 does not work very well on that machine. That's why I used our little capnograph SpO2 monitor here, pulse oximeter. So the leads on this, we only want to use alcohol on. So, because the same thing, it's got a lot of little tiny wires and pieces. We don't want to corrode anything. We don't want any liquid sitting in that CO2 monitor. So I'll just wipe this down. And wipe down the CO2 cup for the capnograph. I'm just going to roll our wires up. I'll use a little rocal to wipe down the outside of the capnograph and pulse oximeter, and then I'll just wrap the lead around that, go back in its box. And then the only other thing we have is our esophageal stethoscope. This is actually a disposable one, since they're pretty cheap. So it actually says on it, don't reuse. But for the sake of the video, cleaning these, if they're not disposable, you will want to use a disinfectant, like a diluted rocal or a neutral pH cleanser. And you don't want to submerge this in water because it'll just come and sit in the end where all the holes are. To make the heart sound. So this one will actually, for that, we'll just show that being cleaned off, and then we will take it off of the stethoscope so that a new one can be put on. So that is pretty much all that for cleaning up all of our surgery stuff. We always like to, especially like this one has moisture in it, so we'll take this Y tube off and clean our bags periodically too, and of course, make sure that we're changing needles and our fluid pump and all, and wiping down the rest of our equipment too, so that just to make sure that everything is nice and clean and sterile in our surgery room.